This is Bruce Jenner, an Olympic medal winner and reality TV star, and has been lauded as a hero for transitioning and renaming herself Caitlyn Jenner. He's lauded not only for his determination and his courage, but the controlled media fawns over his new feminine beauty and stunning sexy girlish curves.
The world is getting to know Caitlyn Jenner this morning.
Caitlyn Jenner stepping out for the first time.
Call me Caitlyn.
Call her Caitlyn.
A brave Olympian transformed.
It's really quite, I think, inspiring.
It's very inspirational.
I think he's courageous.
She looks like a movie star.
She looks like Rita Hayworth, so glamorous.
She is stunning. She looks beautiful.
Wow.
She looks amazing. Look at that. That is a hot woman.
Yes, Caitlyn is hot. It's like, yeah, sexy boobs.
So sexy it hurts.
Who's hot?
Do you think Caitlyn is actually hotter than Chris?
Okay, I have to ask the most important question. Does she have a better body than Kim Kardashian?
It's been reported in Vanity Fair that Jenner has taken hormones to grow breasts, as well as hair removal and facial surgery. As to whether Jenner has been gelded, well, that's anyone's guess, as this information has yet to be revealed. This is Jewel Shuping. She's had a fascination with blindness that started in childhood. She would stare at the sun after learning it would damage her eyes, and by 18 she was wearing dark glasses and walking with a cane. Her desire to lose her sight was so strong that she decided to blind herself by having a sympathetic psychologist pour drain cleaner in her eyes. Experts diagnosed her with body integrity identity disorder. Dr. Michael First, the expert who coined the term, said that in the world of psychiatry, cures are rare. Very often, it's about asking how you can make someone's life fulfilling despite their condition. This is Nano, a Norwegian woman that claims she realized she was a cat when she was 16 years old and has adopted feline mannerisms ever since. When asked if she was born as the wrong species, she said yes. Nano prefers to crawl around on her hands and knees and paws at windows when she wants to go outside, and also she said that despite her size, she can sleep in the sink or on windowsills. This is Stephanie Walsht, who lived as a man named Paul until he realized he was transgender at the age of 46. He left his wife and 7 children to live as a transgendered 6-year-old named Stephanie. After 2 suicide attempts and a bout of homelessness, he found hope in the transgender community in Toronto. He now resides with an adoptive mommy and daddy and spends his time playing with dolls and the couple's young grandchildren. So what is the difference between these 4 people? Well, obviously a person that intentionally blinds herself and another who believes that she's a cat in a human body would generally be considered mentally ill. But in contrast, the contemporary controlled media, and through osmosis and fear of being called transphobic, Caitlyn and Stephanie are both brave, strong, independent women that need to be congratulated for finding the courage to transition. And especially Stephanie, who not only lives as a transgender, but also as a 6-year-old girl. Transgender is the T in LGBT and are lumped in with lesbians, gays, and bisexuals. While the L's, G's, and B's communities are mostly concerned with where they put their genitals, the T's are generally concerned with wanting to remove and or change theirs. I understand that many see transgender as the last frontier in social justice, and the very concept mobilizes legions of the vacuous at university campuses across the United States. Now, those of you listening and grinding your teeth at my intolerance and basking in your own self-righteous, congratulatory, progressive indignation, hear me out, which I understand will be hard. The concept of a trans community is the problem here. You can't satisfy a community defined by an identity of mental illness, except by indulging it. There can be no trans community any more than there can be a community of anorexics or people that cut themselves, or the depressed and manic. You can have a community of the afflicted, of sufferers looking to overcome their illness. But if you indulge a mental illness as an identity, all you're doing is propagating the illness. And being transgender is a mental illness. Dr. Paul McHugh, who is currently Distinguished Service Professor of Psychiatry and former Chief Psychiatrist at Johns Hopkins Hospital, has said that sex changes were biologically impossible and that those doctors who promote sexual reassignment surgery are collaborating with and promoting a mental disorder. Dr. McHugh, who is the author of 6 books and at least 125 peer-reviewed medical articles, made his remarks in an article in the Wall Street Journal titled "Transgender Surgery Isn't the Solution." He explained that transgender surgery is not the solution for people who suffer a disorder of assumption, the notion that their maleness or femaleness is different than what nature assigned to them biologically. While the Obama administration, Hollywood, and major media such as Time magazine promote transgenderism as normal, said Dr. McHugh, these policymakers and media are doing no favors either to the public or the transgendered by treating their confusions as a right in need of defending rather than a mental disorder that deserves understanding, treatment, and prevention. Dr. McHugh also pointed out studies from Vanderbilt University and London's Portman Clinic of children who expressed transgender feelings, but for whom, over time, 70 to 80%, in fact, spontaneously lost those feelings. McHugh's views are backed by studies from across the world. For example, a 2011 study from Sweden, which was a long-term follow-up of transsexuals who had underwent sex reassignment surgery, came to pretty much the same conclusions, that post-op transsexuals are more than 20 times likely to commit suicide than the general population. The Swedish study, conducted over 30 years, from 1973 to 2003, and consisted of all 324 sex reassigned persons, found that persons with transsexualism after sex reassignment have considerably higher risks for mortality, suicidal behavior, and psychiatric morbidity than the general population. Our findings suggest that sex reassignment, although alleviating gender dysphoria, may not suffice as treatment for transsexualism and should inspire improved psychiatric and somatic care after sex reassignment for this patient group. Also echoing the research thus stated are pharmacotherapy studies that are 20 years old that used the drug Pimozide on a cross-dressing man with a strong wish to undergo a sex change. The outcome of the study, as far as I know, has never been mentioned in the mainstream media, or at least I've never heard about it between the cacophony of how Caitlyn Jenner is so brave and so beautiful. But there was an excellent response to Pimozide 2 milligrams daily with a cessation of both cross-dressing and the wish for sex reassignment. When after 1 year the dose was reduced to 1 milligram daily, there was a rapid return of the cross-dressing and the wish for sex reassignment. An increase in the dose again led to a remission, which has been maintained since then. And the conclusion was that pharmacotherapy with Pimozide should be considered in cases of doubtful gender dysphoria. But in all reality, this is one of those cases where you don't really need to appeal to scientific authority, as it's clear even enough to a layman to come to these conclusions. The real controversy, as I see it, lies with people that try to proselytize to the masses on the virtue, dignity, and right for individuals to choose the life of a transgender. This issue has become such that even transgendered people will now be allowed to compete in the 2016 Olympics without surgery, meaning that women with male genitalia will be allowed to compete against women with their original plumbing. And now, even the US has joined most other NATO member countries and allows the transgendered to serve openly in the military. House Minority Leader Nancy Pelosi supported the elimination of rules that ban transgendered people from openly serving in the military, as she believes there is no place for discrimination in the U.S. Armed Forces, including on the basis of gender identity. Defense Secretary Ashton Carter overturned the ban on transgenders openly serving, despite the suggestion that transgender people may have mental deficiencies and be at risk for suicide. The fawning of the transgender has even become a cause to celebrate in children. One young male to female transgender girl, Jazz Jennings, even has his own television show at 14. And this is dangerous for kids that are having gender identity issues, as they see the media and social justice circus, as well as the unique snowflake label and attention that being transgender brings, and they may take the very real and very permanent body solution to a temporary and treatable mental illness. The American pediatrics colleges are now weighing in on the controlled media, social justice advocacy groups, and even President Obama, as they zealously champion the transgender rights for children and their push to normalize mental illness in the name of tolerance, acceptance, and diversity. On the 21st of March 2016, a temporary statement with references was released by the colleges, pending a full statement that will be published in summer 2016. The American College of Pediatricians urges educators and legislators to reject all policies that condition children to accept as normal a life of chemical and surgical impersonation of the opposite sex. Facts, not ideology, determine reality. This statement asserts human sexuality is an objective binary trait. No one is born with a gender-only biological sex. That a person's belief that he or she is something they are not is at best a sign of confused thinking. The use of puberty blockers can have serious negative health effects, and that conditioning children into believing a lifetime of chemical and surgical impersonation of the opposite sex is normal and healthful is child abuse. The story of teenager Rhea Cooper is especially tragic, as at 18 he's Britain's youngest sex reassignment patient. Formerly known as Brad, and after 2 years of hormone injections, he developed breasts, dresses in glamorous outfits, and has dated several young men. Yet despite thousands of pounds worth of National Health Service treatments, as well as psychiatric and doctors' assessments, Rhea has now decided he wants to go back to being a boy. And this decision comes after 2 suicide attempts. And while 18 may seem young, there are examples in Germany of children as young as 12 going under the knife and being allowed to transition between sexes. At this point in the presentation, if anyone is still clapping at the bravery and demanding transgender people have a right to sex reassignment surgery, I encourage you to visit the website sexchangeregret.com. It's filled with heartbreaking stories from people who have transitioned and might help you understand why suicide rates among these people are so astronomical. And if you still think that people are transphobic for not being comfortable with these procedures, or are so firm in your progressive credentials to even attempt to reconsider your ideology, then it might not be that you are a champion of human rights, but a blind automaton lacking empathy and a heart, and choosing ideology over reality. How is handing an alcoholic a bottle of gin humane? How is handing a drug addict an 8-ball of coke humane? How is giving these people expensive surgeries and hormones that further corrupt their already troubled minds humane? Real treatment is possible, but it involves treating the problem, not agreeing with the mental patient and everyone pretending that the voices are real. The key is to treat transgenderism as a mental illness and not to indulge it. You wouldn't hold a coke and sex orgy for somebody suffering from mania. You wouldn't hold a live-action role-playing game event for somebody in psychosis. You wouldn't hold a comedy roast for somebody in the grips of clinical depression. The same is for gender disorders. Don't indulge the mental illness by offering the quote-unquote cure of a transition or the possibility of identifying as your non-biological gender. Recognize it as the self-harm, as I said in the beginning of this presentation, as society does with anorexics or people that cut themselves. In fact, gelding a man to help him with his mental illness is like giving people with suicidal tendencies, but are seeking help, a gun, a pen, and a piece of paper to write their goodbyes. Thanks very much. If you like this video, please consider subscribing as we will be updating this channel often.